Good evening, and welcome to the May 15th meeting of the City Council Health and Human Service Subcommittee. Could we please stand and salute the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and liberty and justice for all. Thank you very much. Madam Clerk.
There's one item on this evening's agenda. Motion presented by Councilor Silvestri that the acting mayor request the director of SUDI to appear before the City Council to discuss the findings of the homelessness impact study conducted by the outside consultant. Several councilors were interviewed during the study, and the results should be provided as requested.
Name and address for the record, please.
Julia Newhall, 44 Humphrey Street. Thank you.
Thank you.
My name is Julia Newhall, and I'm the director of the Substance Use Disorder and Homeless Initiatives Office, better known as SUDI. I'm pleased to be here with you this night to share the findings of our homeless response assessment. But before we hit play on the video, I'd like to provide some context about the process and the circumstances that prompted us to conduct the assessment in the first place. In 2020, the Center of Disease Control warned communities that the homeless population was at high risk of contracting COVID-19. Taking this into consideration and the overlap between SUD and homelessness, and with the help of the Veterans Services Office, we developed and implemented an action plan aimed at preventing widespread transmission amongst this vulnerable population. Specifically, we expanded COVID testing eligibility to include those experiencing unsheltered homelessness to testing sites within walking distance of homeless encampments. We conducted daily outreach to encampments to screen for symptoms and provided single tents to ensure social distancing. Distributed grab-and-go meals and emergency supply kits. Established washing stations in public facilities to prevent cross-contamination. Disseminated educational information about the dangers of COVID and how to prevent transmission, and provided non-COVID emergency housing vouchers for those at greatest risk of contracting the virus. Over the course of 4 months, we conducted 424 one-on-one engagements, distributed over 1,000 meals and 200 masks, and performed 126 wellness screenings. More importantly, we achieved our initial goal, which not a single case of COVID was reported amongst our participants. About a year later, the municipality expanded our office's scope of work to include homelessness to increase the city's capacity to address the growing problem. And while we have successfully met the immediate needs of those experiencing unsheltered homelessness, we have not been able to ensure that homelessness is rare, brief, and non-reoccurring. A goal such as this requires a robust homeless response system, a concept that we knew little about prior to the past couple of years. And in turn, we submitted a proposal to the ARPA committee to hire a consultant to evaluate Revere's homeless response system. After receiving approval from the committee, we met with a number of potential consultants to discuss this project. Ultimately, we hired Lori Harris to conduct their evaluation. And unfortunately, Lori lives out of state, so she's not able to be here in person. But she has pre-recorded her presentation, which I'm happy to share with all of you this evening. I will be available at the end of the presentation for any follow-up questions that you may have. Thank you. You can hit play, Ash.
Hello, thank you for having me. My name is Lori Pampilo Harris. My pronouns are she, her, hers. The SUDI office requests that I provide this recorded presentation to Revere's counsel as I am unable to be there presently. This presentation is a summary of the full assessment provided by the SUDI office in December 2022. The assessment process started in mid-August and then again was completed in December 2022. I believe the full assessment report will be available to you by Julia Newhall, who is there and can provide the full assessment report to you that will go in much more deeper in-depth analysis than what I will be able to provide to you in this really short summary in terms of the assessment findings along with recommendations. I would also really appreciate your grace as I have not had the experience of recording myself or listening to myself for a long period of time in this type of scenario. So for these purposes, there might be some tech issues and you'll see me pause sometimes as I navigate our time together between the recording and also the slides. So thank you in advance for your grace. So thank you to all of you for sharing this time and space with me. I want to amplify and lift up the Department of Public Health and the SUDI office, specifically Lauren Buck, Julia Newhall, Christian Alba, Danielle Osterman, Nicole Palermo, and Nicole Silvestri, who really were fantastic partners and collaborators through the assessment process, including giving of their time, but also and their perspective, but also being able to connect me with the right individuals, organizations, and agencies to speak with through the assessment process. I also like to thank the various city departments that I spoke with, including the Revere Police Department, the mayor and the mayor's office for their time and their shared thinking, the city councilors that I was able to spend some time with, and also through the survey that some of you filled out, and then also the homeless and housing service providers and partners that I worked with and also had some time to spend with. And importantly, really centering the voices of those individuals who are currently experiencing homelessness, who shared their lived expertise with me. Those who are closest to the problem are likely closest to the solution, as they are able to identify the barriers and the experiences that they're having to be able to move from the experience of being homeless to being housed. And so we put a lot of time and effort in thinking through how we were to engage them, and their perspective and their thinking and their wisdom has also been added to that full assessment report that you are going to be looking at, but also through the recommendations that you will see here in a few minutes. So a little bit about myself. Again, Lori Pampilo Harris. I've had the privilege to work across multiple levels of government and also with tribal nations and tribal entities, really focused on housing and homelessness and disaster recovery and response. Some of my most recent efforts include working with the state of Oregon and Governor Kotek's executive order declaring a state of emergency on housing and homelessness. I'm also working with the state of California, providing technical assistance and training to strengthen racial equity and focused activities across its state agencies. And then also, I have been providing HUD technical assistance to Continuum of Cares and housing providers across the country, including the Commonwealth of Puerto Rico. Also provided technical assistance to the U.S. Treasury grantees around the Emergency Rental Assistance Program. And then previously, I also served at the local government level. I was a senior advisor to homelessness to Mayor Buddy Dyer at the City of Orlando. I also joined Mayor Steve Adler at the City of Austin in launching their homelessness strategy office. And in all of those roles, I was really focused on unsheltered homelessness and creating pathways from unsheltered to straight to housing. And so we had some significant gains in both communities when we were really focused on how to engage those who are currently experiencing unsheltered homelessness and getting them quickly into housing and those supportive services to stabilize them. Prior to working with the city of Orlando and the city of Austin, I spent 14 years with Habitat for Humanity International. Again, focused mostly on affordable housing policy issues, but also on disaster housing and response. So for instance, I spent 4 years in Haiti after the 2010 earthquake. So I am going to take myself off of, let's see if I can get it, take myself off of video so we can just focus on the content and the slides. I actually already recorded myself earlier doing this presentation, and it was super long. It was like 90 minutes because it really got into details about the overall homelessness response system, all the building blocks that a community should be thinking about. But I thought maybe I would just do more of an executive summary review here for you and really let you dig into the full assessment that talks about those elements of a homelessness response system and where Revere is and where Revere needs to go to be a part of the homelessness response system locally, but also plugged into what's happening regionally. So you'll find a lot of that information in that full assessment report. So for now, again, I'm going to kind of give you just a high-level overview of some of the assessment findings along with some recommendations. So I'm going to take myself off of camera so we can just kind of focus on the content here together. So there, through the project scope and methodology, what was asked of me was to provide guidance and recommendations to support and advance the work of the SUDI office focused on ending homelessness. And this included collecting and analyzing what data there was available to those that were experiencing homelessness in the city of Revere. It also included over 30 one-on-one interviews, which included the mayor, discussions with providers beyond those one-on-one interviews, and also a community-wide survey that unfortunately did not garner much response. But it also included a city councilor survey, which 5 councilors completed that survey, and 2 councilors agreed to participate in one-on-one interviews. So thank you for your time to that. Time was also spent meeting with those who are currently experiencing unsheltered homelessness, getting their perspective and guidance on the barriers that exist for themselves in obtaining safe, decent, and affordable housing. And so that was the process and the scope that we utilized to do this assessment and create the recommendations. So homelessness. So let's just talk about why homelessness exists and some of the reasons around homelessness. And again, homelessness affects people of all ages and families and can be really exacerbated by a variety of factors, which include natural or human-made disasters, the pandemic, family breakup, domestic violence, lack of affordable housing, and loss of employment, or multiple of these factors happening all at once. And we also know that chronic homelessness, those who have been homelessness the longest, is associated with a range of negative health outcomes, such as lower life expectancy, higher suicide rates, and increased prevalence of physical and mental health problems. The experience of people who live in encampments may be very different from individuals facing homelessness in emergency shelters. But what they all have in common, anybody who's currently experiencing homelessness, what they have in common is this precariousness of their circumstances, the loss of a sense of belonging, and an uncertainty of the future. And so how do we create that sense of belonging again, that sense of community, that spirit of community, and bring certainty to their future about what's next for their life? So we'll be talking about that next. But we know also that the lack of affordable housing can lead to that cycle of homelessness and ill health that also creates complications in being able to treat illnesses. And we also know that providing affordable housing should be seen as a crucial public interest obligation. And it's not only something that the federal government and the Commonwealth of Massachusetts is centering, but also local governments are now needing to expand its role in housing as a prerequisite to being able to end homelessness. So for the city of Revere, what we were able to uncover in terms of the rising population of people experiencing homelessness is that the lack of preservation of affordable housing is contributing to this rise. Also contributing to this rise is influx of new residents to Revere, pushing costs of housing for all income levels. Inadequate income, working but not earning enough to afford housing. I've come across when I was interviewing providers, but also those who are experiencing homelessness. They are working, they are getting a paycheck, but unfortunately, it's not enough to afford housing in the local community. Additionally, 2022 fires also was a contributing factor to those who were precariously housed and also to those who were unable to, who were displaced and unable to find housing again within the city of Revere. The local homelessness response system. So we're going to talk a little bit about what that local homelessness response system is, but the system's strengths that you currently have include your emergency responses, which means outreach and services that respond to the basic needs of people experiencing homelessness and operate with strong harm reduction, health, and substance use disorder supports. This is something that should be really celebrated at the city of Revere. When I work in communities across the country, there is not this specific support system for those with substance use disorder and harm reduction health. The work that the city office does of providing supports to those who are experiencing homelessness, who are facing substance use disorder, is very significant. It's one piece of the puzzle to getting someone on a pathway to housing. And the fact that right now that there's not access to housing for those who are experiencing homelessness, managing and supporting and creating services for those who are unhoused is something that the city office has been able to do well, that other communities have yet to be able to establish. So you guys are really a step ahead when it comes to this particular part of the puzzle for ending homelessness and moving the needle on homelessness in your community. At the system level, there are many well-informed members of the community, such as Dr. Drew Bunker, which I think you guys are familiar with his work there, working with the unhoused population, but also within various departments at the city of Revere who actively participate in efforts to reduce homelessness. But that happens in silos. What's needed is a robust system-wide alignment around priorities and goals. What are our priorities when it comes to those who are unhoused or who are unstably housed? What are our goals? What is the number of individuals and households we want to reach? Also, capacity for data-driven decision-making. There is a lack of data to be able to drive decisions. So how do we begin to collect data as a community so that we know that we're investing where we need it most? And then also a more refined and empowered collective impact model and implementation structure is needed. The funding function and the size of the homelessness response system are not at the scale or level of alignment and coordination needed to begin to reverse the current trends of this increasing population of people who are experiencing homelessness or instability into homelessness. So if there's a snapshot of the assessment in terms of what was causing homelessness and what your current homelessness response system looks like and what needs to change, this would be the slide that would display and reflect that. So I want to just pause here and talk about Housing First. Housing First is a nationally recognized approach to ending homelessness. It is adopted by the federal administration, by the Biden-Harris administration. It's been adopted by the U.S. Interagency Council on Homelessness, which is the connecting entity among all the federal agencies on ending homelessness. It's been adopted by the Commonwealth of Massachusetts and by most states across the country and local communities. And more importantly, it's adopted by HUD and HUD's expectations that communities regionally and locally adopt this approach. And Housing First is an approach to ending homelessness that prioritizes permanent housing to people experiencing homelessness. It's housing first. To end homelessness is to provide a home. And so for those who were prioritizing permanent housing to people, thus ending their homelessness, and then that serves as their platform, as their springboard from which they can pursue personal goals and improve their quality of life. This approach is informed by the understanding that people need necessities like food and a place to live before attending to anything less critical, such as getting a job, learning how to budget, or addressing substance use. Imagine trying to get a job or learn how to budget or learning how to deal with your personal mental or behavioral health issues if you can't even find a safe place to sleep at night, a warm bed to be, a pillow to lay your head down in where you can dream and think and have space to think about all the things that are needed to create your resume, get a job, learn how to do a budget, address the issues that you might have. So this housing first oriented system must be prepared to meet the homelessness in their community. And individuals and families should be able to access permanent housing as quickly as possible when a housing crisis occurs. We know from data from across the country that once someone experiences homelessness and gets into the homelessness system, it's much harder for them to get out of the system rather than diversion and prevention of homelessness. And so we should be preventing and diverting homelessness, but also at the same time, being able to work with those who are most chronic and hardest to house, and work on getting them housing first oriented and giving them the option of providing permanent housing so that they can then again pursue those personal goals and improve their quality of life. So housing first principles, again, it's important for your local system align with housing first approaches, so that anyone experiencing homelessness would be able to enter a shelter, and that shelter should then be put on, that shelter should be housing focused, or they should have access to permanent housing interventions without any prerequisites, and be connecting them to housing as quickly as possible or stabilizing them in housing if they're currently in housing and facing eviction. So for Revere, its policymakers and the local organizational body and the local service providers, you should be firmly rooted in the commitment to housing first. If you are, it gets you access to supports and the regional system and resources where without that commitment, that ongoing never-ending cycle of homelessness for some in your community will continue. You'll continue to manage homelessness rather than solve homelessness in your community. So what is a homelessness response system? In general, the term homelessness response system refers to the various organizations and entities within an area that serve homeless individuals and families. These providers can include not-for-profit organizations, your housing authority, local government, federal government agencies, the Department of Housing Community Development with the Commonwealth, faith-based organizations, the VA, shelter providers, and Homeless and Housing Coalition. And an effective homeless response system should include outreach to unsheltered people. It should include something called coordinated entry, which is the access points for those who are experiencing homelessness to know where they can get support and help from. Targeted homelessness prevention and diversion, emergency shelter, permanent housing, including rapid rehousing and wraparound services during and after their state of homelessness. And this all works because it aligns the community, its funding, its programs and services around one common goal: to make homelessness rare, brief, and non-reoccurring. So homelessness response system, here's sort of the flow chart that is generally what a homelessness response system would look like. So you'll see here, if you're homeless or unsheltered or in a temporary shelter, or you're at risk of homelessness, you're currently housed, but you're at risk of losing your housing, that Access point screening is called coordinated entry. That's the point of where you get assessed for your vulnerability of most likely to lose your housing or your likelihood to die on the streets, your vulnerability index. And so that's called coordinated entry system. After that assessment process, you're then giving a housing intervention assessment. So what's the best type of housing intervention based upon the greatest need? Rapid rehousing, transitional housing, or permanent supportive housing. And then if you are currently housed but at risk of homelessness, that homelessness prevention assessment will be able to retain housing or gain new housing. And that goes back to community-based permanent housing based upon market rate and subsidized housing. Community strengths that were uncovered through this assessment process: a can-do attitude and a spirit of innovation. The community's ability to quickly respond to the emerging needs among persons experiencing homelessness reflects a can-do attitude and spirit of innovation that is unique to Revere. A great example is when COVID-19 happened and you had to move people into safe bridge housing, which gave them non-congregate shelter opportunities at motels and hotels. You guys really figured that out. You put people safely into those units and provided them a place where they could be protected from COVID-19. Also, there's a culture of compassion and empathy. The city is, and this is a quote from one of the interviews I did, is an inherent collaborative and compassionate city. And you have a desire to develop compassionate solutions to homelessness. So there is a need that the city is saying that we don't want to just ignore the issue or think that it's not there. We do want to develop compassionate solutions to homelessness, and there's a pathway there to get there. Increasing engagement of partners from outside the homelessness response system. Several organizations outside the homelessness response system expressed excitement at increasing engagement around preventing and ending homelessness in Revere. And that includes the PATH team, that includes the Balance of State, that includes permanent supportive housing developers and affordable housing developers. When I did interviews, the fact that they knew that the city of Revere was doing this assessment brought great excitement of how they might be able to partner and collaborate and be folded into the larger goals of Revere around ending homelessness for your community. Another community strength is the city's leadership. The staff and their partners are committed to harm reduction and the whole person treatment. They use that non-judgmental listening to engage people, building trust, figuring out what they need to lower the risk of dangerous or fatal outcomes such as overdoses, and really create a personalized path to recovery. I can't say enough about the work that the city office has been doing and continues to do around supporting those who are at risk to themselves and helping to create that personalized path to recovery. And then there's a commitment to ongoing improvement and utilizing best practices. All the stakeholders demonstrate commitment to trying new models or expanding on current successes to decrease homelessness in Revere. Some opportunities that are ahead for the community: need for permanent, affordable housing options and services. I don't think there was a single person that I interviewed from either those who are experiencing homelessness or the providers or from within the city of Revere staff. All of them noted the need for expanded, permanent, affordable options and services that reflect the local realities. And those local realities are rising rents, limited affordable housing stock, and a scarcity of mental health and substance use treatment options in the community. Another community opportunity is the unsheltered homeless population. Unsheltered homelessness has increased steadily in the past 2 years and has begun to raise concerns around health and safety concerns for those who are living in unsheltered situations, as well as for your community members. And this includes questions about how to balance public safety alongside the priority to connect unsheltered persons to available shelter. And those are very limited options, shelter options, and how to best utilize outreach to achieve positive outcomes for persons experiencing unsheltered homelessness. So current outreach is very limited for your local community. Outreach right now is kind of based upon, harm reduction and that whole person treatment care, because there is no outlet or exit to permanent housing. There's no options to give those who are currently experiencing homelessness options to housing. And so that needs to be thought of. And again, creating that affordable housing options for the entire community will help to unplug some of the clogs that are happening in the housing pipeline for your community. Another opportunity is additional funding with more flexibility. More funding will be needed to support the development of housing and services. Additionally, stakeholders expressed concern that there's a lack of flexible funding available to develop new innovative interventions that reflect the reality of homelessness and housing in your community. There is limited coordination and communication. There is a need for increased coordination and communication at the community, provider, and systems level, specifically with the balance of state and your nearby regional partners who are also working on homelessness, those other service providers who are working in communities like Elliott, who would be interested to know how they might be able to support the work that Revere has in terms of moving the needle on homelessness. Again, the need for balance of state COC systems partnership. The balance of state COC is the HUD-funded mechanism in your region to provide housing and services and supports to your local community in Revere and those who are experiencing homelessness. There are many organizations within the homelessness response system who have begun to engage, including the SUDI office. But the more that the SUDI office and the city of Revere partner and engage and be a part of the balance of state and the COC system will mean enhanced opportunities for response and identification of clients who are found in your community to begin them on the path to safe, appropriate, permanent housing options. I do need to note here that even though that you would plug into the resources that are available from the balance of state and the COC, it is still not enough. Local communities across the country are having to invest. And again, the predicator for ending homelessness is housing. And so many local communities are beginning to think about local housing at every income level, from 0 to 30% AMI to all the way up the other AMI, working up towards a 0 to 30% AMI. So some recommended actions that we have here. I just need to pull up my notes before I go on and take a sip of water. So recommended actions: create a shared theory of change grounded in housing first and create a short-term impactful goal. So throughout the consultancy project with Revere, there was no unifying theory of change that governed all resources being deployed to prevent and end homelessness. So if you have a theory of change, it gives stakeholders a clear goalpost that everyone agrees they are moving toward and provides a clear way of evaluating investments. So does this move us towards our long-term goal or not? And what is that long-term goal? That has not been clearly articulated by Revere or its stakeholders. So there is no clear goalpost. The effort is managing homelessness through grants rather than considering braiding local dollars with the state and federal system to actually move the needle on ending homelessness. Another recommended action is create an ending homelessness action plan. So whether a city or county has been addressing homelessness for years or is just starting out, having a plan is really important. The plan provides direction for elected officials and staff as they make decisions about where to dedicate resources and offers a way to measure progress and success. So whether the plan is for 1 year or multiple years is likely to involve multiple individual actions or strategies that may or may not be related. So some of the questions that you might want to ask yourself through that process of creating an action plan is, how often will our plans be set? How often will we review our progress? How often will we report this back to this council here? Do we create or do we double down on the SUDI office and community organizations to coordinate and oversee these efforts? What resources do we currently have, and what resources do we need to tap into? And what is the purpose of the plan? Who is the audience? What is the role and responsibilities of the stakeholders that are part of the plan? And so those are all things that should be considered. If you don't have a target, you won't hit it. And so creating a homelessness action plan will give you a target to hit and help you to understand where to prioritize the very finite resources that are available locally through the Commonwealth and also through HUD. I have also recommended that you discover and explore implementing a public-private collective impact leadership group for Revere. And so earlier in the assessment report, I went in depth about the concept of a collective impact. And this public-private collective impact leadership group would provide systems level coordination for the city of Revere and will be the owner of the issue of homelessness throughout the community. There needs to be someone who is owning this issue and driving the issue and its resources. So that group's role would serve as the coordinator and connector of the various funding streams and systems of care that impact homelessness with Revere. And then they would provide oversight on measuring success, coordinating policy and funding, identifying gaps and programs needs. This public-private collective impact group would display to the community, to the balance of state COC and the Commonwealth that Revere is poised and engaged to be successful in preventing and ending homelessness, which then would provide you with more opportunities for resources and funding towards those targeted goals. The fourth recommendation that I'm making is to conduct a frequent user system engagement analysis, also known as FUSE, which means identifying high utilizers of public resources among persons experiencing homelessness and connecting them to appropriate housing and resources. This FUSE analysis looks at utilization of the medical, mental health, and criminal justice system among persons experiencing homelessness to then identify those individuals who are frequently moving between the street and institutions and utilizing significant public resources and funding. So if you are able to identify those clients who are touching and cycling between those multiple systems, but have not been able to gain housing instability due to vulnerabilities such as mental health, substance use, criminal justice involvement, and chronic health condition, you can then use this information to establish a baseline of understanding of how frequently services are being utilized, who's using those, and making sure that they are navigated to appropriate assistance and supports. I recommend action. We talked a lot already about creating permanent affordable housing options for those who are currently experiencing homelessness or those who have instability of homelessness. But this also means really targeting 0 to 30% AMI housing. And it goes without saying that the shortage of affordable housing is a core driver of homelessness everywhere, not just in Revere, but the homelessness crisis that's happening across our country. And throughout the assessment, stakeholders and those who are experiencing homelessness often emphasize that their primary goal is to secure stable housing. However, because of the shortage of housing, households can spend years on wait lists. And when they describe the act of waiting, how that erodes their social and economic stability, it causes toxic stress and exacerbates physical and behavioral health conditions. We know that households' instability increases as they wait for housing, as does their use of emergency services. So these long wait times of being able to identify housing that can be affordable also corresponds to declines in people experiencing homelessness and their overall well-being. As a part of this, there is a significant need and opportunity to align public housing authority priorities and efforts to end homelessness across Revere. So PHA and the Continuum of Care partnerships in other communities have shown significant success in decreasing the number of people experiencing homelessness, even when the PHA contribution of housing units is incremental. With effective coordination of existing resources, your public housing authority and your homeless service providers working together can streamline connections to permanent housing and ensure that clients receive the services that they need. So there's a significant need to increase staff and focus their efforts purely on homelessness in Revere. And this includes a couple of roles that I have encouraged exploration towards, which includes manager of homelessness response system coordination. The development of this response manager role would work across the City of Revere's departments and intersect with the balance of state, and also disseminate information and provide real-time updates and coordination regarding resources available that would significantly improve the understanding, access, and efficiency of all local, state, and federal resources. Additionally, this person would be responsible for developing cross-agency agreements and structure around the goals and outcomes of preventing and ending homelessness, which would ensure that efforts are successfully resulting in connections to shelter, housing, and services. And the full assessment is some of the responsibilities that person has. The other is an investment in housing navigation. Finding affordable housing at that person's income level where they are currently housed and currently facing eviction or currently unhoused. Housing navigation is key. So housing navigation is essential in assisting clients with identifying housing option, resources, and services that prepare them to successfully engage landlords and meet requirements to obtain housing. Across the country, community organizations seek to provide hope and direction to individuals, families, and veterans at risk of experiencing homelessness through housing navigation. So housing navigators really are the link between clients and services. They work directly with clients alongside case managers, social workers, and other service providers to address clients' needs on entry to homeless service systems. And so this means that they work with landlords, they work collaboratively with housing professionals, and they are positioned to meet the needs and support the productivity and success of unhoused individuals and families as members of the community. And so, for instance, the recent fires and other loss of housing units in this community display that households are in deep need of guidance, advocacy, and linkages to navigating where and how to access available housing options. And right now, the Sudi office does not have that. Based upon the conversations I've had with other providers and departments within the city, there is not a housing navigation focused position that will enable guidance and support individuals and families through their housing search process. Standardizing outreach and referrals to become housing focused through the balance of state COC resources. Again, that is more clearly articulated in the full assessment that you will see there, but pretty much it's not your current emergency, your current outreach, street outreach is really focused on that harm reduction and whole person treatment. And what needs to pivot is for it to become housing focused, and it can't become housing focused until resources are set free through the balance of state and the COC resources, and also through local resources. Increased focus on client engagement and equity through all actions. So I spoke a few times about centering the voices of those with lived experience. The insights of persons with lived experience of homelessness is critical to the development of the homelessness action plan that I recommended earlier. Revere should establish forums and methods for authentic engagement for people experiencing homelessness in the design of strategies and intervention to address homelessness. It's also important that these efforts bring a focus on equity and equitable representation of persons with different lived experiences, including veterans, persons experiencing chronic homelessness, and persons experiencing unsheltered homelessness, along with families. Creating a landlord incentive fund is really a creative way to shake loose some units for those who are currently experiencing homelessness or for preventing families from becoming homeless. So creating partnerships with private market landlords is critical in preventing families from homelessness and moving people out of homelessness quickly. And also to make sure that we're utilizing what available subsidies there are for housing. So working concurrently with Housing Navigator position, a program to incentivize private market landlords to make their units available for households that are referred from the Housing Navigator is an incredibly successful tool. Communities across the country have established landlord incentives funds as a way to increase availability of much needed rental units for families and individuals. In the assessment report, I gave a few examples there from other communities. But for instance, landlords are provided a cash bonus for every lease they make available to someone who's referred to them from the Housing Navigator. And if the lease is renewed another term, another cash bonus is provided to the landlord. So landlords would receive pre-screening and tenant selection. They would receive pre-inspection certification. They will receive landlord and tenant education on issues like rights and responsibilities. And there's a contingency fund to help landlords cover expenses after move out, such as repairs that exceed the security deposits or rent due to unforeseen vacancies. And landlord liaisons and housing specialists will be available to landlords to answer questions or to address or mediate any issues between the landlord and the tenant. And the value of this is it really helps people experiencing homelessness or at risk of losing their homes quickly find housing in high-cost, low-vacancy housing markets such as Revere. It also increases access to affordable housing options and housing stability and creates permanent housing opportunities for those who would not otherwise have it. So the growing severity of homelessness in Revere is the product of a complex web of problems that includes lack of supply and access to affordable and supportive housing, stagnant wages, and an inadequate mental and behavioral health system. But the good news is Revere, through the SUDI office, could be the convener and the backbone agency towards collective impact. Real progress happens when the community works together across sectors and organizations. Revere and the SUDI office can take a vacant and needed role, which is to engage and empower people who are able to accelerate real change, increase the access to services, and collectively end homelessness.
Thank you very much for your presentation, Laurie.
I want to thank you for your time bearing with me to do this recording and listen to this recording. I do hope that the recording, again, which is really high level, but the assessment really digs into some of the details, specifically around the roles and responsibilities from the federal government to the Commonwealth of Massachusetts, and also of the SUDI office and Revere, but also specifically around the balance of state and the continuum of care. That is one thing that I really want to highlight for you all to double down in engaging the balance of state and the continuum of care and building understanding, and also understanding how you can tap into the resources that are there so that you understand what the limitations are and where you might be able to invest yourself locally into making sure that those who are experiencing homelessness in Revere has access not only to those regional resources, but when the regional resources fall short, how the local dollars can go further in helping to end that person experience in homelessness. So thank you again for your time. I'm going to turn it over to Julia now. I wish you all well. And again, I would encourage you all to stay the path. Now is the time to double down on ending homelessness and moving the needle on homelessness. And you all have the tools and the people there to get it done. So I'm looking forward to hearing some really good things coming out of the city of Revere. Take care.
Thank you. Julia, you have
Hi. Any follow-up questions?
councilors, members first. Councilor Cogliandro?
Thank you, Madam President. I don't have any questions. I just want to say thank you. You guys have done amazing work. The work that you've done, especially throughout the pandemic, has become a model for surrounding municipalities. And I think it's pretty amazing that you're being recognized by a national homelessness professional. So thank you for all your hard work.
Thank you.
Any other councilors? Members first. Councilor Silvestri, you want to say something?
I just want to thank Julia for her time in coming up here tonight and addressing this. It's an important issue. It's an issue that we need to stay on top of. And hopefully within an election year and a new administration come in, we can stay on top of these things and keep driving forward on homelessness, and it's not forgotten about. Thank you, Madam
Councilor.
President.
Councilor Powers?
Thank you, Madam Chairwoman. I think anything we do in this direction, okay, is certainly positive. And I think there needs to be more of it. And I think just to sit back and do nothing doesn't work. It never gets to the finish line. So I think I want to thank you and your colleagues for bringing this to the forefront, and I think it has to happen more, and hopefully it will happen more. And hopefully the federal government will become more involved in this, as they should be. Thank you.
Thank you, Counselor.
Councilor Visconti?
Thank you, Madam Chair. Julie, I just want to say thank you for all the work that you and your office have done over the past, and this is great information that we can actually learn from and try to move the homelessness and try to help the problem and end the homelessness in the city. So thank you for all the work that you've done. Thank you.
Thank you, Councilor. Anybody else? Thank you for your presentation, and thank you for being here tonight, Julia.
Thank you. And Ashley has all of the documents. She has the full report if you want to dive deeper into the specifics. And as Lori mentioned over and over again, we need to do more than just respond to the homelessness issue. We need to eliminate the homeless issue. So that requires a robust homeless response system. Thank you.
Thank you for being here. This concludes the Health and Human Service Subcommittee tonight. Thank you.